Hey guys, today's episode is going to be focusing on trauma, so I just wanted to do a little disclaimer about that. As they say, viewer discretion is advised. Thanks for listening, and I hope you find it helpful. Welcome back, everyone, to Meditations by Gregory T. Obert, bringing you the best new guided meditations every other week, and now, for the foreseeable future, on the off weeks, talking about important mental health topics to help you live a better life. I'm your host, clinical psychologist Dr. Gregory T. Obert. Thank you so much for joining me today. And as mentioned, this podcast typically has guided meditations every other week. But to celebrate the opening of my brand new private practice, Royal Oasis Psychotherapy Institute, I've decided to fill the off weeks with important topics related to mental health, to give you all a better lay of the land to help yourselves out, and to determine if psychotherapy is something that is right for you. Now, if you missed it 2 weeks ago, I released an episode, a guide to psychotherapy. What do you need to know before you start any kind of psychotherapy? What are some things to consider? And how do you find a good therapist? So I encourage you to go back and listen to that, especially if you are someone who is struggling. I'm thinking specifically about men in this instance because as I record this in June of 2025, it is Men's Mental Health Awareness Month. So, of course, if you're struggling, it's not weak to reach out. In fact, I would argue that it takes a lot of courage to reach out to a stranger and talk about any struggles that you're having. So whether you're a man or a woman and you want to get that kind of help, check out my practice, Royal Oasis Psychotherapy Institute. I'm one of the best. I have so many cases that have just had wonderful outcomes. Check out my website, see if I'm right for you. The link is in the description, Royal Oasis PI for Psychotherapy Institute, royaloasispi.com. Currently, I have a little bit of a wait list, which is looking to be end of July. So if you want to make sure that you're getting seen as soon as possible, head on over there, royaloasispi.com, fill out the contact form, and I'll get you scheduled just as soon as I can. But without further ado, let's talk about the topic for today. And this is a topic that is near and dear to my heart because it is something that I specialize in. How often have you seen on the internet people throw around the word trauma? Oh, that was so traumatic for me, and oh, that was so tough to get through, and I was traumatized by that thing. Well, I see that word thrown around a lot, and unfortunately, I think people tend to devalue the definition of that word because it's a powerful word, right? When people hear the word trauma, they think, wow, that's intense. The problem is that a lot of times what people go through isn't really traumatic, or at least not to the level of that severe distress that the word trauma tends to imply. So let me give you an example of this. The other day I was watching one of those courtroom dramas, someone suing the other person for XYZ. And in this particular episode, there was a woman who was suing the owner of a haunted house attraction, and she was saying that she was traumatized by the actors in the house, and she ran out just paralyzed with fear, petrified, and on her way running out, she tripped and fell and she broke her wrist. Now, it's possible, I guess, that someone could be traumatized that way. I mean, you could make an argument, but it's going to be a pretty thin argument. Certainly she was scared. Certainly she was experiencing a lot of anxiety. I'm skeptical of the fact that rose to the level of a trauma. And in case if you're curious how the case wrapped up, the judge fell on my side as well and dismissed the claim. So then, if that's not trauma, what is trauma? Well, I'm going to give you a general definition, and then we're going to talk about different types of trauma, especially when it comes to diagnosing trauma, specifically for a mental health disorder, because there's certain thresholds that need to be met in order for that to happen. So, my definition of trauma, which is really the definition of trauma: severe emotional or mental distress caused by an experience. Now, you may be seeing sort of the problem that can come from a definition, but we use words to the best of our ability. When it says by an experience, well, that could be any experience, right? And any person's threshold for what trauma is going to be different. Not might, it is going to be different. So that's why I said it's possible that this lady could have been traumatized. It just is very unlikely, and I certainly wouldn't classify her as having some kind of trauma disorder from that particular event. I have seen other definitions try to get a little bit more specific by explaining that the event has to be deeply distressing or disturbing. Again, that threshold is going to be different for different people and different events. Yet you get the idea. It's some kind of event that is overwhelming or to the point where someone might feel devastated. Now, trauma can come about through a variety of ways, right? Sometimes, and this is usually the most common, is you're going to see some kind of acute trauma, right? Some sudden event that happens that's going to impact somebody. This might look like, hey, it's time for a divorce. Having that conversation can be devastating. It's also true that a trauma can be more chronic in nature, right? So a chronic trauma is something that's going to occur again and again and again. One of the common examples that I will often hear is someone who, say, is cleaning up crashes on highways. When you have a highway crew that's always sorting through debris, potentially some kind of body parts as well, chronically, day in and day out for their jobs, that's going to be a chronic trauma. Now, there's a third type of trauma that I have learned about in the past. I'm not exactly sure just how different it is from, say, a chronic trauma, but I want to at least mention it, and that's a complex trauma. So this is typically considered to be something that is related to a chronic trauma, something that is happening repeatedly, right? You're exposed to it repeatedly, with the added caveat that it typically occurred during some kind of developmental period. So think about abuse, neglect while you were a kid or just at various developmental points in your life. Now, you can take that or leave it. I think it's a very minor distinction, and quite frankly, chronic trauma is going to be devastating whether it happened at a developmental period or not. Certainly, it could be more devastating when it happens during a developmental period, but it might not. And that's what makes trauma kind of tricky, right? Is this subjective nature. Because how trauma impacts somebody is based entirely on individual perception and resilience. I think we all have an example of this in our lives where two people, and maybe we're one of those people, but two people can go through basically the same type of situation, yet both react in completely different ways. Now, an example of what this might look like could be traumatic in nature. It depends on what happens and how this unfolds, but a breakup. Right? There are people in our lives where they've been broken up with. Maybe it's tough, maybe it's hard, but they know that they can get through it. They do the steps that they have to do, and they work through it, and it's good. Some people go through a breakup, and it is devastating, and it's something that, if not many years later, maybe the rest of their lives, they just don't get over it. It's just something that stays with them for a really, really long time. It's the same situation. Details might be different of how the breakup occurred. But this is my point, that it comes down to how we perceive ourselves, how we perceive the situation, and our own resilience, our ability to get through tough situations. Now, of course, there are other factors that can influence how someone takes a trauma, or I should say views a trauma, interacts with a trauma, and that those could be cultural, societal influences. Some cultures, some societies are going to look at a situation and say, well, that's just how it is. You got to deal with it. Whereas another culture might look at that and say, well, that's just devastating. How could you not view that as a trauma? And when I talk about culture, I'm not necessarily just talking about ethnicity. It could be just the culture of your family, right? The culture of your community. Even if you are listening to this in America or wherever you're listening to this, there's different types of culture within America, right? And even within different parts of America, say the Midwest, the South, even in those areas, there's going to be different cultural norms. So these things can impact whether or not someone views a specific instance as a trauma. Now, let's say that whatever happened meets that threshold of being traumatic. Okay, so what happens? Why do people get stuck in their trauma? Well, just a brief overview of how the body and the brain are impacted by trauma. During the event itself, we go into survival mode. You've probably heard the phrase fight or flight. Right? Well, there's also a third option, freeze. Fight, flight, or freeze. That's what our brain is telling our body to do. You think about the freeze option, kind of like when you see a deer in headlights, right? They know danger is coming. They know something isn't right, but they just freeze. Instead of fight the car or run away, they just freeze. And the same can be true for people as well. So, while the trauma is going on, and certainly after, there's going to be 3 big changes that are happening. So first off is going to be in the amygdala, and this is really towards the center of your brain. And this part of the brain really deals with emotional reactivity, and it's going to get really sensitive. Fear is going to start to pop up a bit more easily. Now, the amygdala is very close to another part of the brain called the hippocampus. And the hippocampus is where memory consolidation happens. This is where memories are stored. There's plenty of studies and topics out there around what happens when the hippocampus is damaged. And spoilers, it's really not great. And so when you think about both of these organs, parts of the brain, the amygdala dealing with emotions, and in this case we're going to be focusing more on fear, right? And the hippocampus dealing more with memories, and the fact that they're very close together, well, it makes sense that we as people tend to have emotional reactions when we think about, well, our thoughts, our memories, because they're so close together. And when a memory pops up, well, then some emotions are likely to show up because of that. And so these particular parts of the brain are pretty important, generally speaking, and they are affected considerably when trauma occurs. Because the amygdala is going to get really sensitive. You just went through something that was devastating, terrifying, paralyzing, and now you're going to be looking for that threat everywhere that you go. Part of the reason for that is because one of the theories here is that when someone experiences a trauma, the memory isn't encoded properly into the hippocampus. It's so devastating and so just difficult to wrap your mind around that it doesn't get encoded properly. And it just gets kind of mixed around, mashed around your entire daily life. Think about an example of what this might look like. Think about if you were to take a 3-year-old to go see The Exorcist. Now, for those that aren't familiar, The Exorcist, typically considered one of the scariest, if not the scariest movie of all time. And I watched it a few years ago, and actually it was still quite scary for a movie that was made in, I believe, in the 70s. It was pretty disturbing. And now, if you were to show that to a 3-year-old, how would they experience it? I thought it was disturbing as an adult. What if you were to show that to a 3-year-old? It would likely be so devastating for that child, they wouldn't know what to do with it. It would be like the movie would just keep playing on repeat in their mind again and again and again. Those memories would be tied to that heightened fear. And conversely, anytime they felt afraid, the images of the girl from the movie would likely just pop back into their brain, right? And it becomes this awful cycle of just being unable to get away from the memory. Now, there's also a third major component of the brain that gets impacted by trauma, and that's your prefrontal cortex. So if you put your hand or you point to your forehead, that's going to be your prefrontal cortex. This particular part of your brain works on executive functioning, decision-making, inhibition, emotion regulation. I usually very simply put it as kind of the brakes of your brain, right? Push pause on things so that you can think about what's happening. Typically what occurs when someone goes through a stressful event, that amygdala is going to amp up, right? It's going to send a signal to that prefrontal cortex. It's going to tell the brakes, we can't hit the brakes right now. We got to go. We got to act. And then once the event is over, the prefrontal cortex is going to send a signal back to the amygdala. And it's going to say, you know what? We're good now. Calm down. Everything's fine. No problems are here. We can settle. Now, what happens when that 3-year-old just watched the scariest movie of all time? Well, that prefrontal cortex, it's still going to work. It's not like it's completely broken or busted. It just means that the signal that it's sending to the amygdala is not going to work as well. It's going to be a lot weaker. And whenever that kid experiences any kind of anxiety, even if it's minor, that prefrontal cortex is not going to stop the amygdala as well as it could. So, of course, people find themselves stuck in these cycles where they want to get past a traumatic event, yet they just keep experiencing the same memories, the same emotions. They keep looking for threats in their environments because they survived something that was terrifying. And so, of course, they don't want to, go through that experience again, so they tend to isolate, right? They tend to try to control their lives so that they can avoid any kind of threat. Unfortunately, it's a system that works until it doesn't. And when it stops working phenomenally. A classic example of this would be someone who is traumatized. Let's go with that divorce option, right? Someone who is traumatized by a divorce, I don't want to open myself up to that again, so I'm just not going to date at all. Maybe I'm just going to sleep around and have casual sex. Or maybe I'm just going to stay by myself, just not talk to anybody, not go on dates, nothing. Well, both of those options aren't really healthy for humans. We're social creatures. We want to be understood. We want to have emotional connections with other people in our lives. And just having meaningless casual sex is also not going to be very useful for someone's mental health. Yet, because of that avoidance, right, of being willing to open themselves up to somebody else, well, then they do keep themselves safe from any emotional pain. Yet they also keep themselves from experiencing love and connection with other people. A personal example I have of this would be a number of years back now. God, how many years? It's been 6 years since it happened. I was driving down the highway behind a semi-truck, and a tire exploded off the truck. And I couldn't get out of the way because there were cars on each side of me. So I just had to tank the hit from the tire. Now, thankfully, the tire bounced in such a way that it hit my front bumper and didn't bounce up and, hit me or, other parts of the car. Needless to say, I was quite scared to ride or to drive behind semis after that because those tires are thick. I don't know if you've ever been around a truck tire. It could easily seriously injure or kill you, especially at speeds of, we're going 60, 70 miles an hour down the highway. So, of course, as I was driving in my life, any time that I saw a semi in front of me, I wanted to just get away from that thing. I wanted to be as far away from it as possible, and I certainly didn't want to have to drive behind it. Now, thankfully, I worked through it, and I was able to come back. I still don't particularly like driving behind semis, but I will do it. I can do it, and it's all right. Now, imagine if I didn't work through it. Imagine if I didn't know how to work through it. Well, I might broaden my concerns around safety, because my amygdala would be going off on the highway, to, well, maybe I shouldn't even be on the highway, because those speeds are just too much. Right? And then maybe it becomes, well, maybe I just shouldn't be driving when it's crowded, right? When there's a lot of traffic on the road. So now I'm going to keep myself from going anywhere during large parts of the day. And then maybe it might be, well, you know what? Accidents happen all the time, so I'm just going to stay off the road completely. I'm going to get groceries delivered, and I'm going to get, all my stuff from Amazon, and it's going to be great. Well, now I've created a life where, sure, I don't have as many risks necessarily, but I've also isolated myself. And now I'm not interacting with anybody. I'm not going anywhere. And that can be devastating in and of itself, especially when you're left with these memories of whatever the trauma is on repeat, right? Because as I mentioned, those memories aren't encoded properly into the hippocampus, so they just keep playing again and again and again. Now, I've gone into quite a long explanation here about what happens to the brain and kind of the negative stuff that can occur because of trauma. But here's the great news. The brain can heal. The brain can heal, and that's a wonderful thing. What we want to do is make sure we're giving people the proper treatment. By we, what I mean is mental health, psychologists. And I, in particular, want to make sure that I am using the proper treatment for someone who experienced a trauma. Now, when it comes to a trauma disorder, this is where I like to make the distinction between lowercase t and uppercase T traumas. So when I think about a lowercase t trauma, these, again, are going to be those events that cause severe emotional distress. These can be events, these can be any events. That being said, I might not necessarily diagnose somebody with a trauma disorder until I hear from them that they experienced particular traumas. And these are the capital T traumas. It is not to say that a lowercase t trauma isn't something that can be devastating, because of course they can be. It's just that when it comes to actual diagnosis of a trauma disorder, specifically the big one, PTSD, post-traumatic stress disorder, I gotta hear that you went through some kind of capital T trauma. So, what are those specific events that include capital T trauma? Well, they ultimately boil down to sudden, unexpected violence. That's the basic definition that I can give you. Though the DSM, the Diagnostic and Statistical Manual of Mental Health Disorders, this particular book lists 4 common categories. So, if you directly experienced a traumatic event, now keep in mind these events need to include actual or threatened death, serious injury, or sexual violence, or maybe multiples of those. So, you directly experienced one of these things, you saw someone experience this thing. So, maybe as you were driving along, you saw some car crash and then the cars exploded, right? That would certainly be traumatic, capital T trauma. You learned that this trauma occurred to a close family member or close friend. Now, in this case, again, it has to be the injury or the death has to be violent or accidental. And then finally, someone who experiences repeated or extreme exposure to aversive details. So again, I talked about people cleaning up highways. Think about first responders. Think about ER doctors. Police officers potentially exposed to all sorts of reports and details of child abuse. These are things that someone is chronically going to be exposed to that includes actual or threatened death, serious injury, or sexual violence. So that can leave a mark on somebody. Now, if you've experienced one of these 4 things and you found that, hey, it was difficult, maybe I was able to get through this okay, well, then you're good. You're good. Because I wouldn't say that you have post-traumatic stress disorder just because you experienced one of those things. The issue is that when people don't have an opportunity to properly recover from those events, that is where PTSD can develop. So think about a soldier in a combat zone, right? Maybe they were in a devastating, awful firefight. And what happened? Well, they couldn't take time to just pause and reflect on what happened. The mission comes first. You got to move. And not to mention, if you were to talk about feeling devastated, feeling upset, going to your commanding officer and discussing these things, at best, they would laugh at you and tell you to suck it up. At worst, they might take you off the front line. They might send you to an undesirable detail because you can't cut it. So it's best to shut up and just keep moving. Well, that doesn't make the emotions and the memories go away. It just means that they get shoved down deeper. So these events have to occur, and there has to be some kind of distress, some kind of additional criteria occurring for at least a month. So we break these things down into different clusters. And I'm not going to go through all the specific ones. I'm sure you can look up the different DSM-5 criteria for PTSD. But essentially, I'll pick out some of the key ones here. Your cluster B symptoms, these are going to be your intrusion symptoms. So distressing memories keep coming back. Distressing dreams, flashbacks. These things keep occurring. I mean, you can just be going about your day, kind of that classic joke online, right? Is the Vietnam vet just kind of hanging out, and then all of a sudden they just kind of, the eyes glaze over and they see the helicopters in their mind as they go back to the jungle, right? That's a flashback. And while certainly it can be played for a laugh, when it is occurring for someone, it is very serious and it can be really devastating. The cluster C that you're looking at is going to be avoidance. So this is the classic thing that keeps trauma going, that keeps PTSD going. It's avoidance. It's, I don't want to deal with that thing because it's so hard. And avoidance is understandable, yet avoidance is also the thing that keeps us stuck. Now, people can avoid in one of two ways. There's internal avoidance, so any thoughts, memories, feelings of the trauma, I just don't want to deal with them. I'm going to shove them down as much as I can. That might look like trying to distract yourself. That might look like using substances, you name it. But avoidance is going to be at play. And then people avoid the second way externally. People, places, things. That thing that reminds me of what happened, I'm not going anywhere near there. Those people that remind me, I'm not talking to them at all. Going back to my personal example with the truck, me not wanting to drive behind a truck. Now, I've driven behind semis for decades at this point. How many times has a semi tire exploded and hit my car? One time. Out of hundreds, if not thousands of times I've driven behind semis. But because of that one instance, there was that fear around getting behind that truck. And if PTSD had developed, again, I wouldn't be anywhere near semis. I probably wouldn't even be on the highway. I probably wouldn't even be driving my car, in all honesty. Next up are going to be your cluster D symptoms. So these are changes to your thinking and your mood associated to the trauma. Right? I'm going to view the world as unsafe. Everyone, everything is unsafe. I'm going to put unexpected, or I shouldn't say unexpected, misplaced guilt on myself. Right? It's my fault that I was behind that semi-truck. I should have known that that was going to happen. I shouldn't have even been there in the first place. Well, that's not really fair. How was I supposed to know? There was no way to know. I might, again, lose interest in things that used to bring me joy, have persistent, chronic, intense emotions, fear, horror, anger, guilt, shame. And then your cluster E symptoms are going to be your, what we call the arousal symptoms. Now, when you hear the word arousal, usually people will talk about it in terms of a sexual context. But in this case, think about physiological arousal, right? Think about your body getting activated. So this might look like increased heart rate, right? This might look like irritable, angry outbursts, what we call hypervigilance. This is a really common one for people with PTSD. This is going to be, I'm constantly on guard because I need to make sure I'm aware of any threat that might happen. Your classic example is going to a restaurant. The person who is traumatized has to sit with their back to a wall facing the door because they need to see who's coming in and they need to know that there's something protecting them, behind them. Because if people are behind them that they can't see, that can be a threat. And of course, trouble with concentration, sleep problems, etc., etc. This is the general look at, what I look for when I'm trying to diagnose a trauma disorder. And again, the big one here is PTSD. You may have heard of another one. It's called acute stress disorder. And this is essentially PTSD light. It's the same symptoms, but just within 30 days of the trauma. Some people will develop acute stress disorder and then they won't go on to develop PTSD. In that month, they're able to work through what they need to and they're okay. For other people, they're going to move into PTSD if these if these symptoms are present for a month or longer. Now, for some people, maybe this is you yourself as you listen to this, you might think, okay, well, but maybe there was something wrong with me because, I went through these experiences, but then I came back and it seemed like everything was fine for weeks, months, maybe even years. And then all of a sudden, out of nowhere, I started to experience some of the things that you just mentioned to me, Greg. So what's wrong with me? Well, in fact, that is a common sort of expression of PTSD. We call it with delayed expression. If you were fine for at least 6 months after the event, and again, maybe it's years, maybe it's decades, and then all of a sudden everything changed for you, that doesn't mean there's something wrong with you. It just means that that's how PTSD shows up for some people. Again, I'm going to lean on my Vietnam veteran experience. Well, I have experience with a lot of a lot of different eras of veterans, but one of the common tropes of Vietnam vets, they went to fight, they came back, they didn't talk about what happened because, well, they were treated very poorly, spit on, called baby killers, all of these different things. And so they just buried themselves in their work. And they worked and they worked and they worked and they worked and they didn't think about it and they just kept avoiding. And then what happened? Well, they woke up one day and they turned 65 and they retired. And now they couldn't distract themselves in the ways that they used to. So everything started to come back. They started to experience the symptoms of PTSD. There's nothing wrong with that expression of PTSD. There wasn't anything wrong with those people. They didn't do something incorrect. That's how it worked for them. But here's the good news. Whether someone with PTSD develops it shortly after the event, whether it shows up months, years later, the treatment still works, regardless of whatever the expression is. Now, what is that treatment and how does psychotherapy help people? Well, I want to sort of get the other types of treatments out of the way first that can be supplemental, can be helpful. Though, at least in terms of one of these, I don't directly do it myself. So, of course, there is medication that people can take. It can be helpful for the depressive symptoms. It can be helpful for the anxiety symptoms as well. I personally view medication as something that can be helpful, yet it's just not necessarily going to get to the root of the issue, right? It's going to be a Band-Aid when really stitches are needed. So you'd want to talk to a psychiatrist or a doctor, and psychiatrists are MDs, but maybe not a psychiatrist, but a general doctor as well, about if you or someone with PTSD could benefit from medication. They might. At the end of the day, though, I say that there are more effective treatments for helping people move through trauma that's not just popping a pill. And this is no shame or guilt or me looking down at anyone who might be taking mental health medication for trauma. Just think about it this way, at least this is my perspective, so you take it or leave it. While that's going to help with depressive symptoms, anxiety symptoms, it's not going to help the brain heal, re-encode the trauma. It's not going to help necessarily with the avoidance. It's not going to help with the nightmares, although prazosin can be prescribed for nightmares. But you get my point, that while the medication sounds appealing because it's a quick fix, it's not necessarily going to give the long-lasting relief that people are looking for. Now, there are also other holistic approaches that are great supplements to any kind of trauma treatment that you're doing. Things like practicing mindfulness, meditation, yoga is great to get, to move. Right? A lot of times people tend to store emotions in their body. Now, it sounds a little strange, but think about it when it comes to experiences that you have, right? If someone goes through a lot of stress, right, that's on their heart. The body's working harder, and man, those emotions get stuck there. If someone goes through a difficult breakup, a lot of times that heart, it can hurt. Those emotions are just there. They're sitting there. If you're nervous, if you're anxious, man, you feel that in your belly, right? So by taking some time to do some body work, you help work those emotions out. So, and it doesn't have to be those things. It could be going for a walk, going to the gym, swimming, whatever it is that you do to help get your body moving and get some of that pent-up emotion out, that can be helpful. And I certainly encourage those things. I also encourage community support, peer groups, talking with people who have gone through similar experiences can be helpful. But okay, what is the meat and potatoes? What are the meat and potatoes? What is the meat and potatoes? What's the main event when it comes to psychotherapy for trauma? Well, there's a few different gold standard treatments. And I'm going to go over the ones that I am most familiar with. These are all treatments that I offer through my practice, that I've done dozens of times, hundreds of times. I'm well versed in all of them. So the three main ones that I do, you can think about these as sort of the lowest dose, if you can think about therapy as a dose. Lowest dose to highest dose. Now, at the low end is what's called written exposure therapy, or WET. This is a 5-session treatment. It's once a week for 5 weeks, 60-minute sessions. And with this treatment, someone would meet with me, and I would give them a writing prompt based on trauma, right? Based on the topic that we're talking about today. And then I'm going to give that person 30 minutes to write about whatever the prompt was related to their trauma. After that 30 minutes, we then meet, we talk about what it was like to write about the topic for today. I'm not reading what they wrote. I'm not grading their spelling. I'm not, judging their grammar. What they wrote is for them. But we get to talk about, we get to talk about what it was like to write. Now, the reason this is done, the reason this treatment works, is because it's exposure. This is the key ingredient for helping people move through trauma. It's exposure. Because trauma tells you, don't look at that thing, avoid it, stay away. But that's not going to be the thing that helps you heal. It's going to keep you stuck. And so WET is a way to lightly expose somebody to their trauma so that they can start to heal. And again, it's done in a very safe, supportive environment. Now, this is a low-dose treatment. So maybe someone is dealing with a more mild flavor of PTSD, and WET's all they need. And that's great. I've seen it work for people where it changes their lives. And it sounds a little strange, right? Just go in and write about it and then talk about that writing with a therapist, yet it does wonders. Now, a more moderate dose is what's called cognitive processing therapy, or CPT. Now, this isn't to be confused with cognitive behavioral therapy, or CBT. CPT is a 12-session treatment. It's once a week for 12 weeks. And this treatment focuses on how people's thinking has changed as a result of trauma. Because, shocker, people aren't going to view themselves, others, the world in the same ways. If I were in an active combat zone, for example, I'm not going to view others, myself, and the world in the same ways. If I found myself in a terrible car crash, if I found myself, we don't even have to have a capital T trauma, although I wouldn't use this treatment for someone with a lowercase t trauma. Even if you're someone that goes through a really difficult, awful divorce, right, or a significant death in the family, you might not view yourself, others, and the world in the same ways. With CPT, again, we're focusing on those capital T traumas. And over the course of 12 weeks, we're going to take a look at how your thinking has changed. What tends to happen is that people's thinking becomes quite rigid after a trauma. And it makes sense because that rigid thinking can help people at least feel safe, feel like they're in control, yet it doesn't actually work in the long run. And so we take a look at what we call stuck points, and over the course of 12 weeks, the client would develop skills to identify these stuck points and then skills to work through those stuck points, to change their thinking so that it's more accurate. Again, we're trying to take the unrealistic that has come about because of trauma and change it into something more realistic. This is a treatment that not everyone likes because there's a lot of worksheets, a lot of writing in between appointments. Yet, even still, whether they really like that or they're only sort of on board with the worksheets, I've seen people really make terrific strides in their lives. In fact, I'm thinking about one veteran in particular who basically changed their whole life after going through this horrible sexual assault. They changed their life, and it was really cool to see. So that's the moderate dose, and lastly, there is the highest dose, which is called prolonged exposure, or PE. So this treatment it's really kind of an indefinite amount of time, though usually the average I'll see is 8 to 12 sessions, but it could go more, it could go less. This is once a week, and they're 90-minute sessions, so a little bit more time. And in this treatment, you address avoidance in a very explicit way. You address both of those types of avoidance that I mentioned earlier. Again, your internal avoidance and your external avoidance, really explicitly and really directly. This is one of the most, if not the most difficult treatment somebody could go through in psychotherapy. Yet it is also one of the most rewarding. So, first few sessions are more educational, and then what happens is you develop a list of topics, or I should say tasks, scenarios, settings that people have been avoiding because of trauma. This is your external avoidance. And so once you create this list, you're going to rank order it, least distressing to most distressing. In between appointments, you're actually going to go do that thing. And again, you're going to start lower on the list. You're not going to jump into the deep end right away, but you're going to do it, and you're going to keep doing it, because over time, your anxiety is going to start to go down. Think about the first time you got behind the wheel of a car, right? And that first time, it was probably really anxiety-provoking. Thinking about where the mirrors have to be, thinking about, where your hands are at in the steering wheel and adjusting the seat and this and that. And now, if you've been driving for a little while, you probably don't even think about that. Your anxiety probably is nowhere near as high as it once was for, when you first got behind the wheel of the car. Now, you might be anxious about other things, right? Like what other people are going to do on the road. But that's a separate issue. Your emotional state around your confidence, your anxiety around your own abilities, that's going to be a lot lower, and that confidence in your abilities is going to be a lot higher. Well, the same is true with external avoidance. The more that someone does these tasks, even though they don't want to do them, the more that they do them, the more that anxiety starts to come down. That fear response starts to calm down. The amygdala starts to calm down. The prefrontal cortex starts to send a stronger signal. Right? Because we can only be 10 out of 10 anxious for so long until the body needs to relax. And that's the idea here, right? That you throw yourself into it repeatedly, eventually, not only in a session, but over the course of time, that task becomes easier. Now, the internal avoidance is addressed in session. Once you and your therapist pick the most distressing trauma, because sometimes people have multiple, we want to pick the hardest one. And the reason for that is because, not because we're trying to torture somebody, but because when you learn how to manage your memories, your emotions around the hardest trauma, well, that's going to give you an ability to work through the other traumas that might still be tough, but not as tough. It's sort of like, I'm going to take on this more difficult challenge so that I can accomplish challenges that aren't so tough. Kind of like when you see in baseball, people will put weights on the bat, right? And they'll use that so that when they actually go up to the plate, they take the weight off. Wow, I can hit the ball a lot farther. So once that memory is selected, what you do is you start at the beginning and you're going to tell that memory all the way through. And then you're going to go back to the beginning and you're going to tell it all the way through. And you're going to go back to the beginning, you're telling it all the way through. And you're going to keep doing this for a period of time. And the reason for this, again, isn't because we're trying to torture somebody. It's because we're trying to bring down that fear response. We start to retrain the brain and the body that talking about this event, thinking about this event, is not the same as it happening. And so the body, the brain, does not have to react as if it's happening. This is going to help the brain start to re-encode that memory as just that, as a memory, not something that is constantly happening and playing over and over and over and is ever present with them. Now, as I mentioned, this is a hard treatment, yet it is one that I've seen so many people it's life-changing for a lot of people. And I'm grateful that I've had the opportunity to see that. And I'm glad that the people who went through it have better lives. Finally, the fourth treatment that I offer, I don't know where it would necessarily fit in that hierarchy, if you, again, think about therapy like a dose, but it's called narrative exposure therapy, or NET. And so this is a treatment where it's similar in terms of putting stuff down on paper. In fact, what you do is you create a timeline of your life, all the major points in that life. And we go through that timeline sort of quickly at first, just trying to kind of get the facts of the major events in someone's life. And then, once we're done with that, we go back to the beginning and we dig into these events in a lot more detail. We sit there, I want to know exactly what was going on. I want to know exactly, what you were smelling, what you felt, what take me to that moment. So in that sense, it shares a little bit with prolonged exposure. We don't do this necessarily for every event on the timeline. We call it the hot side of the timeline, where you take me there. We focus specifically on those traumatic events. And over the course of the session, over the course of the treatment, someone can really start to place these events on their timeline like it is. It was an event. It was a memory. It is not something that is currently with me. So that, coupled with the exposure elements, helps people to heal. It's a bit longer of a treatment. It just depends on how old somebody is. It depends on how much trauma they've experienced. But it is something that I think can be useful, particularly for people who have had extensive amounts of trauma over the course of their lives. Now, of course, there are some other treatments out there like EMDR, and I'm sure there are some other treatments related to trauma. These are the ones that I'm most familiar with and ones that I think are best suited for individuals looking to heal from trauma. Now, you might be saying, if you are somebody who has trauma in the past, who may be dealing with an official diagnosis of PTSD, or maybe you're suspecting that you might have it based on everything that I've said today, probably a lot of the treatments, if not all the treatments I said, sound really unappealing. And if that's the case, then you might be right that trauma is something you're struggling with. And to that, I have two questions. The first question is, what have you got to lose? And what I mean by that is people I've seen for trauma have had this trauma for, many of them it's years, decades. Though I've worked with people, maybe it's been a year, right? A few months. Why not give it a shot and give me 5 hours if it's wet? 5 hours of your life. Or 12 hours if it's CPT. Or 8 to 12 times 90 for prolonged exposure. Why not give it a shot? What have you got to lose? And the other thing that I would throw out there, I don't know if it's really a question, but I would throw this out there. You've already gone through the most difficult part. You've already done it. And the most difficult part is living through the trauma. So if you can do that, then I'm confident you can talk to me about whatever the trauma is that you experienced. And considering my practice is virtual, all of my clients get to stay wherever is most comfortable for them. Usually it's going to be in their own homes. So I'm confident that whether it's a 60-minute session or a 90-minute session, depending on the treatment, whatever we end up talking about, whatever I throw at my clients, they can handle it. So why not give it a shot? Something to consider over the course of this, again, Men's Mental Health Awareness Month. This is something you're struggling with, men out there, and women, if this is something that you're struggling with, why not go for the best? I'm someone that knows his stuff, and I encourage you, again, check out my practice. See if I'm someone that you think would work best for you. Because again, I want to make sure that I'm a good fit for you. There are some people that might not like my style of therapy, and that's fine. What I can say is that I'm an expert in this area, and this is something I have helped many people with, and I can help you with too. But that's going to about do it for this episode. I'm actually a little surprised it's as long as it is. I didn't intend for it to be about an hour, but I'm happy to do it, and I hope that it was helpful for not only my regular listeners, but also others who may have just stumbled upon this and are looking for some extra information, support around trauma. And I hope that by talking about trauma today, it was helpful for you to understand what I think about as a professional when I think about trauma, and not just kind of the common way it's thrown around on the internet or maybe even in your personal life. So thank you all for listening this far. If you have, and if you've gotten some value out of this, please leave a 5-star rating and review wherever you're listening to this. And if it's time for you to take the bull by the horns, metaphorically, and to actually get your life back, take your life back from trauma or any other mental health condition, check out royaloasispi.com, links in the description. Shoot me a message, and I'd be happy to talk with you about treatment. And I can get you on my wait list, and we'll get started in less than a month. So think about that. Think about that relief that you can experience. And I hope you do reach out if this is something that you're considering. And if so, I look forward to working with you. As for everyone else, if you enjoy what I do here, remember that these episodes come out every other week, at least for a little while, and I will be putting out another guided meditation to help people just try and relax, get their zen on in a week from now, so be sure to keep an eye out for that. Again, I've been your host, clinical psychologist Dr. Gregory T. Obert. Thank you so much for listening, and until next time, be safe, be well, be powerful.